Well, hello there. Are you bored, stuck in the middle of a pandemic, or suffering a mild existential crisis? We'll help you out. Let's take a dive into the history and decode the origins of diagnostics. Mahatma Gandhi once said, "A correct diagnosis is 3/4 the remedy." It stands true till date, as it has since ancient times.
From tasting urine to microscopy and to molecular testing, the sophistication of diagnostic techniques has come a long way and continues to develop at breakneck speed.
Throughout history, there have been three main phases into which the advancements of medicine have been classified. Discoveries have been made in the field of medicine as well as in the methods of diagnosis. These developments stretch across the ancient times, the Middle Ages, the 17th, 18th, and 19th centuries, and extend till recent years.
Today, in Decoding Diagnostics, as a starting chapter in the A Chronicle on Diagnosis series, we will be discussing some of the greatest minds from the ancient and Middle Ages mankind has seen in the course of evolution of clinical diagnosis. This is the globe, with many, many modern-day countries and many, many ancient civilizations. Let us zoom into the grand Egyptian civilization where this is the wrong Imhotep. Yet this is the real Imhotep.
Possibly, he was the first and earliest known physician in the world who belonged to the rich and ancient Egyptian civilization. He was appointed as the chief minister to Djoser, the second king of Egypt's third dynasty. Although his step pyramid is considered his greatest achievement, he was also remembered for his medical treatises, which regarded disease and injury as naturally occurring instead of punishments sent by gods or inflicted by spirits or curses. He was deified by the Egyptians in 525 BC and was equated with the demigod of healing, Asclepius, by the Greeks. Imhotep became a medical demigod after almost 100 years of his death, and is still held in esteem by physicians who, like the eminent 19th century British practitioner Sir William Osler, consider him the first figure of a physician to stand out clearly from the mists of antiquity.
But even before or parallel to Imhotep's time, there was another physician hailing from ancient India, Sushruta. Regarded as the father of Indian medicine and father of plastic surgery, he is the writer of the well-known ancient Sanskrit text, the Sushruta Samhita or Sushruta's Compendium. This text is considered as the oldest text in the world on plastic surgery and is highly regarded as one of the great trilogy of Ayurvedic medicine. According to legend, the gods passed their medical insight down to the sage Dhanvantri, who taught it to his follower Devodas, who then instructed Sushruta. We know one thing for certain about him, that he practiced medicine along the banks of river Ganges at Varanasi, India. From developing different surgical techniques to specializing in rhinoplasty, Sushruta has contributed greatly to the medical field.
Another physician from ancient India was Acharya Charak. Born in 300 BC, Acharya Charak was one of the principal contributors to the ancient art and science of Ayurveda, a system of medicine and lifestyle developed in ancient India. Acharya Charak has been crowned as the father of medicine. His renowned work, the Charak Samhita, is considered as an encyclopedia of Ayurveda. In his work, he has described the medicinal qualities and functions of almost 100,000 herbal plants. His principles, diagnoses, and cures on human anatomy, embryology, pharmacology, blood circulation, and diseases like diabetes, tuberculosis, heart disease, etc., retain their potency and truth even after a couple of millennia. Okay, now let's go to another part of the world, our good old Greece. One of the most well-known and documented personalities of the Age of Pericles is Hippocrates of Kos, or Hippocrates II. Hippocrates is credited by historians with moving the subject of medicine away from the previously supernatural and religious approach towards a modern approach of observation, classification, causes and effects, and so on. Hippocrates has his contribution in writing a large number of ancient treatises, speeches, and letters on medicine, collectively referred to as the Hippocratic corpus. To obtain a clear picture of disease, Hippocrates advocated a diagnostic protocol that included urine analysis by tasting the patient's urine, listening to the lungs, and observing skin color and other outward appearances. Hippocrates is rightly enough known as the father of modern medicine.
Knowing some more physicians of Greece, Rufus of Ephesus, a famous physician, lived about the years 80 to 150 CE. His theories stressed the importance of anatomy, and he preferred a realistic approach to his diagnosis and treatment. In the introduction of his work on the names of the parts of the human body, the brief explanation of the anatomical terms include position, shape, and functions of organs. The first description of hematuria, or the presence of blood in urine, done by him surfaced at around AD 50 and was attributed to the failure of kidneys to function properly in filtering the blood.
Another famous Greek physician, Galen, was also an author and a philosopher working in Rome who influenced both medical theory and practice. While he criticized many of his contemporaries, he embraced the ideas put forth by the Greek physician and theorist Hippocrates, giving birth to the concept of the four humors that govern the human condition: blood, phlegm, black bile, and yellow bile. Much of our knowledge of early medicine comes from Galen's writings. Like Hippocrates and other theorists, Galen believed that illness was caused by an imbalance. So how one restores the balance? Bleeding, enemas, and vomiting. Galen believed that the knowledge of anatomy was vital to a physician, and his interests ranged from the study of blood and the heart to tuberculosis and even cancer. Today, most of Galen's theories have been disproven. Modern doctors, though, must accept his recommendation of exercise, a balanced diet, good hygiene, and bathing. Due to this outstanding contribution, he came to be known as the founder of experimental physiology.
Isaac Judaeus Israeli has been classed among the great physicians of the early Middle Ages. From 875 to 904 AD, he apparently was a successful eye doctor near Cairo. After 904, he became court physician in Al-Qayrawan. At the request of the Caliph Al-Mahdi, Israeli wrote 8 medical works in Arabic. All were translated into Latin in 1087 by the monk Constantine, who claimed to have written them himself. Not until 1515 was their true authorship uncovered, and the works were republished in Lyon under the title Omnia Isaac Opera, or All of Isaac's Works. The editor, however, mistakenly included the writings of other medical scholars as well. Israeli scientific works include standard treatises on fevers, urine, pharmacology, ophthalmology, and ailments and treatments.
And with that, we come to an end with the diagnosis in the ancient and Middle Ages. Although we must tell you that we may not have been able to include all of the personalities in this video, but there are a lot of geniuses and pioneers from all around the world who were once laughed at for their intellect, but have made valuable contributions to the betterment of mankind by providing never thought of techniques and ideas in the field of diagnosis.
So many contributors, known and less known, yet we are still at the ancient and Middle Ages. There is so much more to know, guys. In our upcoming vlogs, we will be speaking about personalities from the 17th, the 18th, and the 19th century, and some of the modern day contributors, and how all of these contributed to the field of medicine and medical diagnosis and the sophisticated cutting-edge techniques and treatments that we see today. So, we will be signing off for now. Thanks for watching.